that puts him in a posture that is going to be standard. And now, any resting symptoms? Do you have any problem right now? Okay. So make sure you understand, today we're doing full exam and not a scanning. So we're going to include flexion, extension, as well as side bend, rotation, quadrant, all components. Okay? All right. So have you go ahead and bend forward as far as you can. Okay. And I'm going to come back up. Any problem with that? No? Okay. Go ahead and do it again. I'm not paying attention to where motion is coming from and all that. We'll get to it later. I'm going to apply overpressure. And have okay. You guys remember the extension? Do I need to do it or you got it? Got it. Okay. Quadrant, you got it?
Can you apply overpressure with quadrant?
We usually don't. You can, but yeah. Because it's a combined motion. And so, yeah. Okay, side bending, I'm going to be standing behind him. I'm going to have Nathan slide his right arm towards his right knee. And you know, you can't help it but to observe the back curvature. Go ahead and stand back up. So I'm going to have you stand face this way so you can get some. All right, go ahead and turn to your right side. And then basically you want to observe his curvature, come back up to see if the motion is coming from all segments or if he's kind of producing motion at one segment. So both of them looked really good, but sometimes when you look at people's posture, you see that they have these creases, and those creases indicate excessive motion from that segment. And so that could be, most of the times, extension, but it would also have a rotational component that I have mentioned a couple times during the lecture, that you pick that up with side bending. So when they side bend to the right, you see that most of the motion is coming from that segment. Come back up. And I'm going to have you side bend to the left. Okay. And now we're going to apply overpressure. So I'm going to lead the way here. Okay, go ahead and go to the right side again. And here's my hand position. One on his left hip, one on his right shoulder. And I'm going to help him up to the left. Good with that? Okay. With the rotation, we do it a couple different ways. If you just want to analyze the motion, that he can do it in standing, I'm going to put my hands here. I'm going to have him rotate to his right side. And I just kind of want to see how far he goes. Okay, come back up. And then to the left. And he's doing a nice job. And come back up. Without rotating from his pelvis. That's kind of what I was monitoring here. But I obviously cannot apply overpressure here. So I'm going to have him sit down. And then I will have him do rotation and we'll apply overpressure. Again, I'm quickly going through the movement analysis because we have a whole lab that we're going to spend on it. Okay. I'm going to have Nathan go ahead and rotate to your, yeah. And to the right. And he does pretty good. He's a little bit limited to the right. He did pretty good with the left. So you kind of get close to them and apply rotation. I was switching from my position from side to side because sometimes what happens is patients rotate this way. They're likely to compensate by rotating in the opposite direction from their lower body. So I'm standing on his left side when I'm applying overpressure to his right rotation. And I stand his right side when I'm applying overpressure to his left rotation, just to prevent that motion from his legs. Functional tests, I think you're pretty good. You can assess them yourself, right? Sit to stand, all that stuff. Twisting, well, some of it was that functional test, bending forward, twisting, all that. Okay. We'll go through the flexibility tests later. Scanning, we have already done it. The next thing is passive physiological motion. But before we get to it, I want you guys to go ahead and take just 5 minutes or so and practice that.
Okay.